At Invitae, we believe that when you are preparing for or adding to your family, genetic information can help you plan. While most babies are born healthy, every pregnancy has a small chance of having a baby with a genetic disorder, even when there is no family history. Carrier screening can unlock valuable information about your risk of having a child affected by a genetic disorder, so you can make the choices that are right for you and your family. Let's begin by talking about genetics. Genes are made up of DNA, and they are the instructions that tell our bodies how to grow and develop. A child receives half of their DNA from each biological parent. This means they have 2 copies of most genes. Genetic disorders can arise when variants or changes occur in the DNA and the genes do not work properly. Being a carrier typically does not affect your health because you have another copy of the gene to make up for the one with the change. We are all carriers of genetic conditions, but since our own health is not usually affected, we often don't know we're carriers until we have this type of genetic screening. It is not unusual to be the first person in your family to know you're a carrier of a particular disorder. Your chance of being identified as a carrier depends on how many disorders you are screened for, your ethnic background, and your family history. If you and your partner are both carriers of the same disorder, there is generally a 1 in 4 or 25% chance with each pregnancy that the child will be affected. Some exceptions to this are disorders where only the mother needs to be a carrier for the child to be at risk. Both the American College of Obstetricians and Gynecologists and the American College of Medical Genetics and Genomics, leading authorities on reproductive genetics, recommend offering carrier screening during or before pregnancy. Additional testing may be recommended for you if you or anyone in your family has a genetic disorder. Carrier screening involves collecting a blood or saliva sample. Once Invitae receives your sample, it will take between 10 and 21 days on average for the results to be ready. Your results will be available online through our patient portal. After your testing is complete and you have reviewed your results, Invitae's genetic counselors are available to help answer any questions you may have about what to do next. A negative result means that no significant changes were identified for any of the genes tested, and the chance that you are a carrier of these disorders is greatly reduced. No test can detect all possible carriers, so there's still a small chance that you are a carrier. This is called residual risk. Your report will list your residual risks for each of the disorders tested. A positive result means that a significant change was found and you are a carrier of 1 or more disorders. Being a carrier typically does not affect your own personal health. However, it does mean that there is an increased chance to have a child with that disorder. This chance depends on the combination of your results and your reproductive partner's results. Typically, the next step after having a positive carrier screen is to find out whether your reproductive partner is also a carrier of the same disorder. Knowing the carrier status for both partners uncovers your combined risk to have an affected child. You may wish to speak with your doctor or a local genetic counselor to better understand what your results mean for you and your partner. You can also call Invitae to speak with a genetic counselor for no additional charge. Additionally, you may want to inform your family members of your carrier screening results. They may also be carriers and may wish to be screened, especially if they are thinking of adding to their own family. If you and your reproductive partner are found to be at an increased risk of having an affected child, it is important to know that you have choices about how you use this information. Depending on when you have your carrier screening, there are options available to you before pregnancy, during pregnancy, and after delivery. How you use this information is up to you, and there is not one right path for everyone. Let's review what we've covered. Carrier screening is a type of genetic test that can provide important information about your risk of having a child with a genetic disorder. Carrier screening can be done prior to or during pregnancy and should be considered by everyone, even those without any family history of a genetic disorder. We are all carriers of genetic disorders, so you shouldn't be surprised if you are identified as a carrier through this screening. Carriers typically don't have the disorder themselves, but do have an increased chance to have an affected child. A negative carrier screen result reduces your risk of having an affected child, but cannot completely eliminate that chance. Knowing your carrier status lets you make the best choices for you and your growing family. Thank you for choosing Invitae to be your partner in your reproductive care. If you have any further questions, feel free to give us a call or visit us at invitae.com.